Good day everyone, my name is Francis Alan Mercado from BSN 1B. Today I'm going to demonstrate bed bath. So what is bed bath? Bed bath is the science of health and maintenance, personal hygiene, is the self-care by which people attended to function as bathing, general body hygiene, and grooming. So what is the purpose of bed bath? First is to remove microorganism or body secretion. Second is to improve the circulation of the skin. Third is to promote relaxation and comfort. And fourth is to prevent or eliminate body odors. And fifth is to promote sense of well-being. And sixth is to assess the client. And the seventh is to provide activity and exercise. So these are the equipment we are going to use in this procedure. First is basin or sink with warm water between 43 to and 46 degrees Celsius. And next is soap and soap dish. And next is linens including the bath blanket, two bath towels, washcloth, clean gown or pajamas or cloth, and bed linen and towel if required. So in this procedure, we are going to use gloves if appropriate, if there is any presence of fluids or any lesions. And next is personal hygiene articles including the deodorant, lotions, and powder, and shaving equipment for meals if necessary. And next is table for bathing equipment and the laundry hamper. Francis Alan Mercado, I'm your nurse for today. And next we are going to verify the patient. Okay, your name is Mr. Baroma. And next, we are going to wash our hands and observe appropriate infection control procedure. I'm going to wash my hand using the 70% alcohol. And after that, provide patient privacy. I already closed all the curtains and door to provide privacy for my client. And next, prepare the client and the environment. First, invite a family member or significant other to participate if desired. And second, I already closed the window to ensure the room is a comfortable temperature. And third is to offer client bedpan or urinal or ask whether the client wishes to use the toilet. And next is to encourage the client to perform as much personal self-care as possible. During the bath, assess each area of the skin carefully. And now, prepare the bed and position the client appropriately. The client is already in a comfortable position. I position him in a supine position. And next is position the bed in a comfortable working height. And after that, place a bath blanket over the top sheet and remove the top sheet from under the bath blanket by starting a client's shoulder or moving the linen down towards the client's feet. Make sure that the client was covered. And then remove the top sheet without exposing the body of the client. And after removing the top sheet, put it in a linen hamper. And next, if the bed linen is to be reused, place it over the bedside chair. If it's going to change, place it in the linen hamper. And next, remove the gown while keeping the client covered with the bath blanket and place the gown in the linen hamper. And now we're going to remove the gown without exposing the body of the client. Make sure that the body of the client is covered well. And place the used gown in a linen hamper. And after removing the gown of the client, I am now going to use the gloves. In washing the client's face, we must first put a towel on the client's head, support the head of the client, place it under the head of the client. And next, we are going to use the towel. Meet it in your hand. Like this. And now we are going to clean the face of the client, starting from the eye. We are going to use both sides of the towel, starting from the eye, inner to outer, and to the other side, inner and outer. If the client is conscious, you can ask his or her if he want to wash his face with soap or and water. And now we are going to clean the ear and the other side of the ear, the face, and the client's neck. Okay. And then dry it using another towel. Make sure that everything is dry. Okay. And after cleaning the face of the client, we must remove the towel under the head of the client and place it on the linen hamper. And now we are going to wash the arm and the hand of the client. Now we are going to use the towel and meet it in our hand. And expose only the shoulder of the client. Support the hand of the client and make sure that it is clean. The hands. And after that, we are going to use another dry towel to pat dry the arm of the client. Make sure that everything is dry up to the hands. And you can use a powder and put it in the arm of the client. Okay. And do the same procedure in the other hand of the client. Expose the arm of the client and support it and place the matting towel under the arm of the client. And now I'm going to use the meat and clean the hand of the client and support by supporting his or her hand up to the hands. And after that, pat dry the hand of the client using another dry towel. Make sure that everything is dry. Okay. And remove the bath towel and place it in the hamper. And you can use powder. And cover again the body, the arm of the client. And now we are going to clean the abdomen of the client. First, we need to put a bath towel on the chest of the client and lower the blanket. Now I'm going to use the meat. I'm going to apply a firm and smooth stroke. And after that, pat dry the chest and the abdomen of the client using another towel. And after cleaning the chest and the abdomen of the client, we are now going to replace the blanket of the client and place another one. Okay, let's remove this one and place it in the hamper. Make sure that the body of the client was covered and remove the used blanket. Place it in the hamper. And next, we are going to clean the leg of the client. First, expose the area. Expose the part of the client that you are going to clean. Use a bath towel and place it under the leg of the client. use the meat. And at this point, I'm going to use a long, smooth, firm stroke all the way from the ankle up to the thigh of the client. After that, pat dry the leg of the client using another towel. Make sure that everything is dry up to the thigh of the client from the ankle. After drying, remove the used bath towel and cover the part that you've already cleaned and expose the other leg of the client. Place again another bath towel and support the leg of the client. And next, we are going to use the meat. And clean the leg of the client from ankle to thigh. I'm now using a firm and smooth stroke all the way from the ankle to thigh. Okay, and pat dry it with another towel. Make sure that everything is dry. After that, remove the bath towel and cover the exposed part. And next, I'm going to clean the back and the perineum part of the client. First, I'm going to assist the client to face opposite side to make sure that the body was covered. And next, place a bath towel at the back of the client. Place it in a lengthwise position. And next, we are going to use the meat and clean the back of the client without exposing his or her body. Okay, after cleaning the back of the client, use another towel to dry the area. Okay, and remove the bath towel and place it in the hamper. And after cleaning the back of the client, you can perform a soft massage in the back of the client. And assist the client in a supine position. And now I'm going to clean the perineal part of the client. I'll be the one to clean and while the client was straight. And after that, we're going to use another towel to dry the part. You can use lotion to moisturize the part of the skin of the client. And now I'm going to remove my gloves and place it in the discarded in a garbage bag. I'm going to wash my hands. And after that, document findings in the client record. Good day everyone, my name is Francis Alan Mercado from BSN1B. Today I'm going to demonstrate about bed shampoo. So what is the purpose of bed shampoo? First is to stimulate the blood circulation to the scalp through massage. That's why we need to massage the scalp of our client. And next, to clean the hair and increase the client's sense of well-being. And equipment we are going to use are the comb and brush, plastic sheet or pad, 2 bath towels, shampoo basin, washcloth or pad, and next is the bath blanket, receptacle for the shampoo water, and next is the cotton balls, pitcher of water, and bath thermometer, liquid or cream shampoo, and last is the hair dryer. And now, explain to the client what you are going to do and why is it necessary and how can he or she cooperate. Since our client is unconscious, still I will check his name. Okay, your name is Mr. Baroma. And today, sir, my name is Marcelo, sir. And today I'm your nurse for today. I'm doing a bed shampoo. Is it okay for you, sir? And um, is it necessary for you, sir, to remove any oil buildup in your hair and to remove any dirt in your hair? Okay. After that, I already washed my hands and I'm just going to wear my gloves so that our hands would not get wet. And after, position the client diagonally in bed and prepare the client appropriately. So I already position the client and the bed diagonally. And next, I'm going to arrange the equipment. I already arranged the equipment and remove the pins and comb and brush the hair thoroughly. Please remove the tangles of the hair. Since my patient is male, I don't have any pins to remove, so I'm just going to comb his hair. So first, now I'm going to remove the pillow. We place it beside the client, and I'm going to put a a waterproof sheet to avoid to protect the bed from any spillage. Yes, and after that, place a kelly pad under the head with neck hyperextended. Since we don't have kelly pad, I'm going to use basin as an improvise. Okay. So now I'm going to cover the eyes of the patient. I'm going to use a towel to prevent his eyes from any irritation caused by the shampoo. And plug a cotton ball on his ear canal to prevent um, the entering of the water on his ears. So now I'm going to thoroughly wet the hair of the client. And apply a small amount of shampoo. Massage the scalp of the client with the pat pads and fingers to make the rich lather, and massage promotes circulation in the scalp. Rich lather ensures thorough cleansing of the hair. Okay. After shampooing the hair of the client, we are now going to rinse it with water. Make sure that you rinse all the shampoo in the hair of the client so that because it may cause any irritation to the scalp and the hair. And it also can cause hair dryness. Okay. So now I'm going to remove the towel and put it in the linen basket. Remove the cotton balls. And now I'm going to dry the hair of the client using this towel. Going to remove the basin and dry the hair of the client. And now we are going to use the hair dryer to immediately dry the hair, to make sure that the hair of the client is dry. Okay. Remove the towel after drying the hair of the client. And lastly, comb the client. And remove the waterproof sheet. And place the client in a comfortable position. And after that, we are going to document the procedure. So Mr. Baroma, 25 years old, done of his bed shampoo. Francis Ana Mercado from BS1B. Today I'm going to demonstrate the oral care for unconscious. The purpose is to remove the food particles from around and between the teeth. The second is to remove the dental plaque. Third is to enhance the client's feeling of well-being. And fourth is to prevent the sores and infection of the oral tissues. The equipment we are going to use in this procedure is first the towel, disposable gloves, curved basin, toothbrush, cup of tepid water, dentifrice, mouthwash, dental floss, at least 2 pieces, and floss holder. So now I'm going to perform a oral care in an unconscious patient. So now we are going to explain to the client what we are going to do and why is it necessary and how can we cooperate. So my client is unconscious, but I'm still going to check his identity. His name is Mr. Baroma, And so, good morning, sir. My name is Francis Aldo Mercado. Today, I'm going to do a oral care. And next is, I already washed my hands, and so now I'm just going to wear my gloves to observe any infection control. And next is provide the patient privacy. I already closed the door and all the curtains. And next, have a suction apparatus readily available. Since we don't have a suction apparatus, I use a improvised suction apparatus. And next, we are going to use a padded tongue blade to open the mouth and brush the teeth and gums using the toothbrush or soft brush. Now, sir, now I'm going to position the client toward me. And I'm going to place the kidney. Now I'm going to put the kidney basin near in the mouth of the patient. Next, I'm going to use the toothbrush and put a small amount of toothpaste. Okay. So now we are going to brush the teeth of the client. We are going to brush the upper part and the lower part to remove any bacteria. Okay. I'm done brushing the mouth of the client, the teeth of the client. And next, we are going to wipe the mouth of the patient and carefully remove the kidney basin and wipe the mouth of the client. Use the suction machine to remove the excess liquid in the mouth. Okay. And next, we can apply a small amount of petroleum jelly on the lips of the patient. Okay. The petroleum jelly can help to avoid the cracking of the lips of the client. And next, we are going to position the client on a comfortable position. Okay. And after that, we are going to document on the client's chart. So, Mr. Baroma, 25 years old, done with his oral care.